How does oral immunotherapy work for treating food allergies? Have you ever wondered how oral immunotherapy works for food allergies? This innovative treatment aims to help people build tolerance to specific food allergens. Oral immunotherapy involves giving small, controlled amounts of the allergenic food to the patient. This process usually starts with very low doses that gradually increase over time, all under the watchful eye of a healthcare professional. The science behind oral immunotherapy is rooted in the concept of oral tolerance. Our immune system has a natural ability to become less reactive to substances we eat. However, in individuals with food allergies, the immune system mistakenly identifies certain food proteins as threats. This leads to an exaggerated immune response, often involving immunoglobulin E antibodies and mast cell activation, which results in allergy symptoms. During oral immunotherapy, the patient is repeatedly exposed to low doses of the allergen. This exposure helps regulate the immune system, primarily by promoting the production of regulatory T cells. These special cells work to suppress the allergic immune response. They modulate the activity of other immune cells that cause inflammation and allergic reactions. As a result, the production of immunoglobulin E antibodies decreases, and the sensitivity of mast cells and basophils is reduced. These cells are responsible for releasing histamine and other chemicals that trigger allergy symptoms. Over time, this immune modulation leads to a state known as desensitization. This means that the patient can tolerate larger amounts of the allergenic food without experiencing severe reactions. In some cases, a state of sustained unresponsiveness may occur, where the tolerance continues even after stopping regular exposure. However, this outcome is less common and is still being researched. It is important to note that oral immunotherapy is typically conducted in a controlled clinical setting. This is due to the potential risk of allergic reactions during the dose escalation process. Careful patient selection, ongoing monitoring, and strict adherence to dosing protocols are essential. This ensures that the benefits of increased tolerance are balanced against the risks of adverse reactions. In summary, oral immunotherapy retrains the immune system through controlled exposure to the allergen. It promotes immune tolerance by employing regulatory mechanisms that reduce allergic sensitivity. This approach provides a promising option for managing food allergies, enhancing quality of life by lowering the risk of severe allergic reactions from accidental exposure. However, it is not a cure and should always be pursued under the guidance of allergy specialists, who can provide personalized medical advice.